every day.
Welcome to Style with Trish. Today we have Dr. Angelina. She's going to teach us and really give us the ins and outs on plastic surgery as well as weight loss. You don't want to miss this episode. We'll be right back.
Every day a woman reigns. It's time to live your dreams. Nothing's gonna stop you now. Keep going, keep going, keep going. Every day a woman reigns. Every day a woman reigns.
Welcome back to Style with Trish. We're continuing our conversation with Dr. Angelina. Kind of share your background because you have some multiple degrees and all of that involved in your expertise. Share that with us, if you will.
Thank you for having me.
Absolutely.
So I am founder of a large clinic that specializes in weight loss surgery and cosmetic and plastic surgery. So myself, I do have 3 board certifications in different areas of surgery. So multi-specialty practice, in general surgery and critical care trauma surgery, and then cosmetic surgery as well. And a lot of surgeons that work for me in my practice, I have 9 surgeons. Half of them are weight loss surgeons, specialize specifically in that field, and half of them are plastic and cosmetic surgeons.
Okay, that's awesome. You go, girl. So what inspired you to go into this particular field, and how has it been being in this field, being a woman? And being able to, because you're very soft, because you have to be, about your business, but you're also very soft. Share why you went into this field and how your experience has been so far being a woman in this field.
Well, I'm not sure if I'm soft. Being a trauma surgeon, we have to sometimes be a little bit not soft. But we first started the practice in 2011. Me and my husband, he's one of the surgeons in my practice.
Okay.
And we wanted to provide best surgical care in a rural community and the communities outside of the city. That's why we started outside of the city in Gwinnett County.
Okay.
We noted a long time ago that people who live in a city, they can go to large hospitals and get care that they need. But once you the further away from the city you go, the harder it is to find a specialist.
Right.
So we started our private practice back in 2011 here in Gwinnett County and slowly grew from there. So then we started introducing what we felt was needed for community. So of course, weight loss surgery is one of those things, right? It's epidemic, obesity. So 40% of populations in Georgia is obese, meaning they could qualify for the surgery.
Really?
40% of population in the state of Georgia. And of course, we know it affects more people who are not as privileged financially, African American community, Hispanic community, right? So it's all kind of there.
Right.
So first it started with that, and then as of course that took off with a lot of demand, then people start coming to me specifically in my practice because I'm a female surgeon and we have a lot of female patients. Well, what about breast reduction? What about now the skin removal after weight loss? Now I lost the weight, now I want to look good and feel good about my body and get my curves back rather than just having hanging skin.
Right.
So that actually triggered me to go back and do an additional fellowship to get additional training to be able to do all of the cosmetic surgery.
Okay.
And so then we can help people globally in my practice. And as a female, I think if females, other female patients, they feel that I understand what they want. I'm not going to overdo it. I'm not going to make them look fake. I'm not going to go and put huge implants just because I like it, because that's what I see a lot from patients coming in for reductions now. Like, why did you get large implant before? Well, doctor said it's going to look good.
Right.
I'm like, did he try to carry them around? So I feel like I do understand better.
Yeah. You were saying that 40% of Georgia is eligible for weight loss surgery. What is the weight, I guess I should say, how much overweight of your natural weight should you be if you were to be eligible for that surgery?
So there's not like a number. And generally in the business, we talk about BMI, body mass index. It's calculation between your height and your weight. It does not apply to everybody equally. It's based on your background.
Okay.
And we're trying to change it in bariatric community, but in standard, if your BMI is 35 and over, then usually we'll recommend surgery.
Okay.
Now, there's some people who may be of like Asian background, somebody who naturally very, very tiny bones, very small person.
Right.
For them, maybe 27 over BMI could be detrimental to their health, and they may qualify for surgery.
Okay.
But it's not standard of care on paper.
Right.
Because those numbers were calculated so long ago.
Yeah, yeah.
So
you're the first doctor I've ever heard say that or admit that. But with the BMI, just for those who just may not know what their BMI, where can you go to get that?
Very easy Google search, BMI calculator, put your numbers in there, we'll give it to you.
Oh, okay. So that's simple.
It's a very simple calculator on any Google search.
Okay. Okay, so we're going to start out with the the cosmetic side, and then we're going to do the weight loss here later, because you got a lot of information on that part. You mentioned you do cosmetic surgery. What all does that include? I think you said that include Botox, chin. Break that down for me.
So I kind of go for surgical and non-surgical side of things.
Okay.
So the non-surgical side in the clinic, right? You can come in and get a facial, get a laser, get laser hair removal, Botox, fillers, skin tightening on the chin, little procedures, maybe a little eye lift, a little blepharoplasty, removing excess skin on the eyelids. So small things, mole removal, mole checks, little lumps and bumps, all of that stuff can be done under local anesthesia, just in the office.
Okay.
And then surgical side of things, well, that's everything else.
Okay.
So we're talking about mommy makeovers. I'm putting it in quotes because it's not actual procedure, mommy makeover, but it can include tummy tuck, liposuction, breast reduction, breast implants, breast lift, and back lift, thigh lifts.
Back lift?
Yeah, you can do back lift as
I
well.
didn't even know that was a thing. Okay.
There's a lot of things we can do. Thigh lifts, so reduction of the thigh. When people lose weight, a lot of times they don't like a lot of looseness and hanging skin, so we can liposuction and take the skin off here. Little wings,
Yeah.
brachioplasty,
Right.
and anything in between.
Okay.
Yeah.
And so what is one of the, we're going to take a break here in 1 minute, but what is one thing, if we're doing the lighter procedures, are there anything prior to coming in for those procedures that we should be aware of? Should we, something that we should do in preparation within ourselves? Like some surgeries they'll say, or procedures they'll say, okay, well, you can't eat after a certain time or anything. Does that apply to the ones that are not surgical?
The things we do in the office are generally things we do not put you to sleep for. You don't do anything different. The main things I would recommend usually not to take a lot of things that make you bleed prior to it, like a week prior. So no excessive alcohol, aspirin and ibuprofen, turmeric supplements, vitamin E supplements. Those things will increase your bleeding time. And so you can just get more bruising.
Okay.
So we usually recommend those kind of little things to do at home, like to minimize chances of bruising. It's more cosmetic things.
Okay.
But if we do actual procedure like blepharoplasty or neck lift, you're not just showing up. You'll be getting instructions prior to that from the office on what to do, what not to do.
Right. That's interesting. On a break, we're going to talk about the turmeric and vitamin E. But we're going to take a really quick break. When we come back, we have more with Dr. Angelina. We'll be right back.
That's good.
Welcome to Trish's Treasures. This is where I share some of my favorite beloved products that I use on myself with you. Our treasure for today is the Flawless line. And I know you guys have had to have seen the commercials or the advertisements for this particular line. And boy, did I go crazy on this line. I got everything from every shaver that they have, which we have the shaver for the legs. We have the shaver for your brows to clean up your brow line. We have the shaver if you got a little hairiness around your lip. Or your chin. I have the shaver for that. And of course, the intimate shaver, which is for your intimate parts. This particular shaver, all of these products I absolutely love. They're easy to clean. They're easy. The upkeep is very easy to maintain. And I just, like I said, as you see, I went crazy. This right here is the after I use and cleanse my face and moisturize my face, just for some added circulation, which is good to move things around. this electric brush is what I use after I apply my moisturizer on my face. And it just makes it feel good under eye, all around the eye. It's just a really great product. But this is definitely a Trish's treasure.
Have you ever thought about having your own talk show? Well, you don't have to question yourself any further. From concept to completion, Mark Squared Studios can easily take you through a traditional 3-step process for any video production. Whether it's a small business commercial, talk show, cooking show, or even a web miniseries. Contact us today and we'll help you unbox your creativity.
Every day a woman ran.
We are back here on Style with Trish, continuing our conversation with Dr. Angelina. Before the break, we kind of tapped into cosmetic surgery, and one of the things that you shared with us off camera is that it's very important, even when you're getting cosmetic surgery. The example you used was tummy tuck. That it's very important that your weight is in check, or I won't say in check, but you consider having a healthy weight before the surgery. Can you expound on that?
Of course. I get a lot of patients coming in asking for tummy tuck as their last resort for weight loss. And it's a wrong thinking. Liposuction and tummy tucks are not weight loss procedures. They will not affect your overall health, and they will not affect your weight maintenance. A lot of people under impression that, well, if I get this procedure done and I spend this money, it's going to motivate me to get up and do stuff. And it's proven not to work. There have been studies that shown when people are going to try to do any kind of weight management programs without surgery and without medicine for weight loss, 99% of them will fail. They might lose the 30 pounds or 60 pounds. They more likely to gain it back again very quickly, usually with a little extra bonus on top.
Right.
And they're going to keep losing that same 30 pounds up and down. So even they say, well, I succeeded. I was like, well, where is it now? Where is that success now? Because, oh, Corona happened, somebody broke their foot happened, changed my job. There's always an excuse why the weight goes back up.
Right.
So using a surgery, something that we do, like gastric sleeve, or using medications that I mentioned, GLP-1 medications right now on the market, Wegovy, Ozempic, Mounjaro, many others, to help you lose weight, combinations of those treatments to get to your healthy weight, where your blood pressure is controlled, where your gastric reflux controlled, where your migraines controlled, where many other medical conditions that come from increased weight, diabetes, blood pressure, right? All those things. Get that under control first, then take care of the outside. So inside first, outside second.
And it makes so much sense. Here recently, DC Fly, the comedian's girlfriend and mother of his children, she passed after what you called the...
From what we hear, it was mommy makeover procedure, I believe.
Procedure.
We don't have all the details, I don't believe yet.
Right. And, well, they know that she was having that procedure. We just don't know what the complications were. And I wouldn't say she seemed like she was a small person and things of that nature. How important is it for anyone who is seeking out a cosmetic surgeon? What do we look for? What type of doctor, what type of credentials should we be looking for to get the best care that we can in those type situations?
Best thing is to look at board certifications, so either board eligible or board certified by American Academy of Cosmetic Surgeons or plastic surgeons. Experience. In this situation, we also want to ask, and I know that's a weird question to ask a surgeon, do you have malpractice insurance? There's a lot of doctors that open up clinics and they don't put the time and don't have malpractice insurance. We know by itself, technically it's not a crime not to have the insurance, but usually most hospitals will not give you credentials if you don't have malpractice insurance. So if doctors operating out of the freestanding facility, and if anything goes wrong with the patient, you need to have an ability to transfer them to the hospital that you work with, or some nearby hospital where you have privileges to operate in. And in this situation, if you don't have that privilege, that means in my mind, the doctor more likely to say, oh, don't go to the hospital, we'll take care of you, because they cannot go in there and do anything either. And so that puts patient in a dangerous situation.
Yeah.
In a facility like mine, we are accredited facility, meaning it is outpatient surgery facility, but it's accredited. All the doctors in the facility are accredited and board certified in different fields. We have malpractice insurance. So we try to cover everything from every angle, and it is in our best interest to take care of this patient to the best of our ability. So those things we need to ask. Just because your girlfriend went there and had a good experience, it does not mean every person will, because you don't know what complications happen that are not being reported.
Right. That's scary. And I think that we say here on the show all the time, do your research before, especially if you're doing major surgery. One of the things that stuck out when you were talking again was you talked about the tummy tucks and the things that doesn't do anything. That fat will return if you don't change or have a changed lifestyle and eating patterns. So to take that much of a gamble and go to someone who's not accredited or doesn't have the insurance, it just isn't. For me, it's just not willing. I'm not willing to do that type of gamble, and as well others should not be. So once we've had the tummy tuck, what is some of the aftercare or other procedures? What are some of the aftercare routines or things that we should expect?
Well, in my patients' populations, is main thing in my practice, I want them out of bed and walking day 0.
Okay.
So in the recovery room, they'll be up and walking.
Okay.
So I do everything in my surgical practice to minimize the pain, give all kind of medicines, injections, to make sure the pain is well controlled, that they could get up and walk around to prevent other complications. We all know that people will usually make you wear some kind of a compression garment under direct care of the doctor, but you have to listen to your surgeon and not Google in this situation, where we tell you not to wear a garment today. Don't wear it today. Just because your girlfriend did it doesn't mean you should.
Okay.
If I tell you not to put anything inside the garment like boards or foams, that means I don't want that extra pressure there right now. Don't do that. But mainly it's very straightforward recovery if you follow your instructions. Get up, walk around, put your garment on when you're told to, and don't lift anything heavy for a while. Drink plenty, maintain your weight, don't overeat. Pretty straightforward.
Pretty straightforward. We just got to do it. Be obedient. And
you just got to do what you're told for that one time.
Okay, so we're going to take a really quick break. When we come back, I want to talk about I can't say the word, bariatric surgery and what all is entailed in that. Guys, we'll be right back with Dr. Angelina.
Hi guys, it's Dr. Cassandra Evans, affectionately known as Dr. San, and this is your segment of Let's Learn Love. Hi guys, this is Dr. San, and I'm here with your segment for today, and we're talking about putting your best foot forward. Sometimes putting your best foot forward is not the easiest thing. Whether you're a male or a female or you're non-binary, it's understandable that putting your best foot forward sometimes is difficult. So what do we need to do to put our best foot forward? Well, if we're talking about going out in public, one of the main things we have to do is make sure that we're in a good place. You know, sometimes we carry, the problems that we have in life outside. But that's not fair to the outside. So what you want to do is you want to make sure that you're cheerful, you're happy, and you put a smile on your face. And the reason why I say that is because sometimes when you smile at someone, they smile at you back. And that exchange of energy can make you feel better. It's sometimes you need to make sure that you're put together well. And sometimes that is what makes you feel better as well when you're putting your best foot forward. You want to make sure that you're taking care of your clothes, your hair, and whatever else you need to do to make yourself feel good about you. The third thing that I would say about putting your best foot forward is investigate your town or wherever you're from. Sometimes if you're more knowledgeable about the place that you're going or where you can go in your town, you feel a little bit more at ease, and that helps you put your best foot forward because you're confident about the things that are going on around you. So tell me what you think putting your best foot forward looks like. And make sure that you reach out and you contact us and you follow us on all social media. So for that segment for today, this is Dr. San, and this is Let's Learn Love.
Welcome back to Style with Trish. We're continuing our conversation with Dr. Angelina. I want to get on the weight loss surgery. You said there's all different types of weight loss surgeries. Now, prior to weight loss surgery, put it this way, who is a ideal candidate for weight loss surgery? Let's start there.
Any patient that's trying to lose weight that couldn't do it on their own, and maybe been overweight and obese for quite some time. A lot of those patients will have other diseases accompanying the process, so diabetes, high blood pressure, sleep apnea, and many others. And so for, of course, most patients, I prefer for them not to develop diabetes or high blood pressure or other comorbidities in order to get the surgery.
Right.
You know, I don't want them to be that sick in order to prevent them getting sick. I'd rather kind of do a preventative approach. So definitely patients who need to lose over 100 pounds, I would recommend surgery first.
Okay.
However, if somebody is a smaller person in height, somebody, let's say 5 feet tall, for them 60 pounds could be already pretty too much. Yeah, because there's, you know, just overall smaller body frame. So it's kind of a percentage based.
Okay.
But definitely, you know, those numbers, 60 to 100 pounds overweight based on height, definitely would recommend some kind of surgery.
Okay. And let's talk about, we were talking off on break about the obesity and how obesity is a disease. Can you please break that down? Because you were mentioning how it should be considered as if it was diabetes or some other type of disease. We kind of just say a person who suffers or battling with obesity, they just need to pull back from the table or they just need to work out. Can you share your thoughts on the disease of obesity?
So obesity is a disease. It's in the same metabolic syndrome as diabetes, as PCOS, and insulin resistance, and many other conditions. Obesity is a disease because it's a syndrome that causes other problems in your body, right? Obesity doesn't happen just because you're lazy and you eat too much, right? If anything, it's opposite. Usually we see people who work 3 jobs,
right?
Don't have enough money for enough food. And most patients I talk to, yes, some of them do overeat or eat unhealthier foods.
Yeah.
But a lot of them, by the time they got to us, they eat less and actually shutting down their metabolism. They've been doing crazy diets that's shutting down their metabolism. They've been waking up at 5 in the morning to do boot camps. But there's nothing that can sustain that weight loss long enough without extra help.
Yeah.
There's definitely a genetic component to it, other than just environmental.
Right.
So the old time advice of go home, stop eating, and work out more does not work. It's been proven. There's studies.
Yeah.
Also, obesity causes diabetes. Obesity causes 13 different type of cancers, increases the chance of. Obesity causes other medical surgical complications. Heart attacks, strokes, the list goes on, right?
Right.
Inability to have kids. A lot of people who are obese cannot conceive because the hormones are really out of line. And all of that will normalize as we lose weight. People will lose diabetes as they lose weight.
Right.
People will lose their blood pressure and many other conditions. So it is a syndrome. It's a disease. And we need to treat it as one.
Yeah, and last question before I have you kind of speak to our viewers is you mentioned earlier about the use of the Ozempic and Mounjaro.
Wegovy.
So for someone say that they're maybe 30 pounds overweight or 40 pounds overweight, are those medicines that, you know, if they came to you, possibly be something that you would prescribe for them?
Absolutely, yes. So we prescribe or dispense. We have options for patients. And yes, they need to consult with me and I will look at their overall progress, their medical conditions, and I can definitely prescribe medication and provide it for them. It is expensive medication. As I said, we do have some different options for patients, but it's a great tool that we have now. And I can have patients on this medicine prior to surgery, and then several months, a year or so after, let's say, gastric surgery for weight loss. Usually they kind of stabilize in the way weight loss. It stabilizes, so we can add those medicines as maintenance.
Oh, okay.
Or people who don't need surgery, like you said, somebody who just needs 34 pounds. They're too small for gastric bypass or gastric sleeve, but they're too big for what they need to be.
Right.
And it all, of course, depends on their height and overall frame. And so they absolutely qualify for some of those medications.
Okay. Thank you. You've been so informed. I've learned so much from you, and I know our viewers have as well. But if you can, before we roll out of this show for the today, can you kind of share and inspire us women to be more in tune with our health, and if we need these extra tweaks and snips here and there, that we still want to be as educated and be as powerful in our decision making as possible?
Absolutely. So I want women to know that it's okay to ask questions and not be shy. There's not such thing as too many questions. You know, Google is great, but you're going to hear all the bad things there too. So make sure you ask all the proper questions to your doctor. Don't be afraid to come to the doctor. I get a lot of patients kind of being very nervous in the first consultation. I'm like, look, no knife. We're not doing anything today. Let's just talk and kind of break it down.
Yeah.
And it's okay to love your body the way it is. So a lot of patients get very concerned about their cellulite and certain hanging parts. I was like, look, if it doesn't bother you, absolutely does not bother me. And I guarantee you, does not bother your man. They like the jiggle. So fix things that you feel are going to empower you more, you know, skin texture to brighten up your skin, you know, those like typical facials. It could be just very little things that are going to make you look good and feel good about yourself. I will tell you if you need some Botox and fillers. You know, I'm not going to lie, but I'm not going to point out the flaws.
Right.
So a lot of doctors will say, well, you need this, you need this, you need the butt lift. I was like, no. Tell me what bothers you and I'll tell you what I can do about it. You know, if something's super obvious that I know I can do, but I feel like you don't know about it, I'll tell you. So find doctor who are going to be honest with you and not push you into surgery that you don't really want. Like, breast can naturally hang. You put it in the bra and you're happy with it. I'm happy with it, right? Who cares?
Right.
You know, but if it bothers you, then we can fix it. So I want to make sure that you stick to that mindset that you are powerful and you're beautiful the way you are, and it's okay to use us as cosmetic surgeons, but don't get pressured by girlfriends, by boyfriends, by anybody else, just yourself.
Yeah, I love that. And we say that all the time here on the show, that you know, it starts from within. And if you feel ugly, if you feel like you're ugly, you're looking in the mirror and you see ugliness, let's go internal and start fixing that internal stuff first. Then once that inner self is healed, then I think we would make a lot more healthier decisions when it comes to Botox or, you know, things of that nature. And so you got to have self-love first, and then we can go to Dr. Angelina and get that self-care from a professional who's going to definitely tell you the truth, because she's been telling us some truth here today, guys. But thank you so much.
Botox anybody can have anytime.
Yes,
I correct you on that
anytime.
Surgical, we got to think about it.
Right, right. So thank you for hanging out with me on today. I had a lot of fun with you on today, guys. Make sure you check Dr. Angelina out in her practice. Research, research, research. As we always say here, we'll be right back. We think of the word style and we only tend to think of how you dress, but style comes in so many different aspects. Like, what style of management do you prefer, or what type of manager are you? What type of leader? What's your leadership style? What is your love language? That's a style. What's your style of parenting? These are different areas of style. It isn't just about what you put on, but it's about what's in you and how you like to rock out and live your life. Hey guys, this is Trish Standley. Catch up on season 1 of Style with Trish by going to TryshStandley.com. If you are not able to catch the show on YouTube, make sure you go to my website, TryshStandley.com, and check out our podcast, TryshStandley.com.
Have you ever thought about having your own talk show? Well, you don't have to question yourself any further. From concept to completion, Mark Squared Studios can easily take you through a traditional 3-step process for any video production. Whether it's a small business commercial, talk show, cooking show, or even a web miniseries. Contact us today and we'll help you unbox your creativity.
I don't know about you, but I learned so much from Dr. Angelina, even just down to being careful when you're going to do procedures if you're on vitamin D or on turmeric, which are two things that I take. Never realized that could affect the procedure, especially with someone like me who already bruises very easily. So that's knowledge I'm going to put in my keepsake pack anytime that I'm going to have any type of procedure done, to kind of pull back on D3 and turmeric. They're good for you, but not in those type situations. One of the other things that I learned from her is that it's very important to make sure that we do pay special attention to our weight loss. And a lot of times weight loss and struggling with your weight is because of obesity, and obesity is a true disease. It's nothing to take lightly. So whatever measures, whatever you need to do for yourself, the healthy way, make sure you seek out the professional that will help and guide you in the way that you should go. As always, thank you for joining us, and remember that love isn't love unless you give it away.